But but I know I'm looking at these faces. They almost all of you are familiar, and I know a few of you. And I've been here living in the Valley for 20 years, and I was the school nurse for 18 years, and I just retired. And I considered school nursing really was public health, interacting with the families and having an impact on this whole community. I must say that I'm glad I'm not doing that right now, because there's another nice, fine young nurse that's doing that, and that's Adriana Van Bianchi has taken my place there. So, but I started working with Betsy when we were coordinating contact tracing during our big surge in July and August. And it was really fun to get to know her that way. And of course, I've known Tracy since she moved here 20 years ago too. So I as well am very appreciative of this organization. I'm a volunteer. Now I have a question. Are these mostly volunteers or members?
I would volunteer. I think we've got a good crossover of people who are members and volunteers, and a very few people who are just volunteers.
Okay, I just wanted some idea there. Although it seems like all us volunteers will eventually become members or are members simultaneously, but utilizing the services eventually. So what did you want to?
I'll go ahead. What I'm going to do is share my screen with you guys and with some slides. And as I say, please feel free to put your questions into the chat, and Tracy will monitor those for us. Here goes.
Good.
Amazing, it works.
Yeah.
I think we've said this, but you know, this work is all about you, and we've struggled with how to support our members during the pandemic in a way that protects both them and you from COVID transmission. We feel really lucky that so many of you have been willing to participate in helping people with transportation and helping people with some outdoor services and helping people with getting to doctor's appointments and getting their food at the grocery store. But we are committed to keeping you safe. And this is what it's all about, keeping you and our members safe. We have taken our lead from the Center for Disease Control and the Washington Department of Health and from Okanagan County Public Health. They are our resources. And I'm going to turn the next step over to Laura.
And I'd just add, Betsy, that Tracy was able to consult the other villages in our state to help with writing this policy and procedure and to give us some guidance in this whole process. So that was really helpful too.
We're hoping that all of you have had a chance to take a look at the policy and procedure ahead of time, because that'll make this hopefully less boring and you'll be able to contribute as well.
So I was going to talk to I thought after we talked about this, we thought we need to take a step back and make sure we're all on the same page as far as the basics of COVID-19, how it's transmitted, and the basics in protection. And then it'll help us. This whole process is sort of helping us go from the facts that we know, and they are changing facts because this is a new virus. Coronaviruses in general have been known. It's a type of coronavirus, but it's a brand new one. That's why they call it a novel coronavirus. And because it's brand new, our bodies, human beings, did not have any protection from it with their natural immune system. And so that's why it spread like wildfire through the whole world. And that's why we've had to develop ways to fight it, to treat it, have been really, it's been a lot of trial and error and figuring things out. So I know that's caused some confusion of, do we use masks or not use masks? And that's really that human process that we've been going through of dealing with something that no one knew anything about and then figuring it out. And so these are the basic things that we've figured out. We know it passes easily from person to person. And we know that it's transmitted mainly by respiratory droplets, whether you call them aerosolized or just droplets, it's by the virus coming out of someone's mouth. And that can come out by talking, singing, coughing, sneezing, or just breathing. And the only way, at this point, while we're getting near to the vaccine, it's just sort of that basic creating a barrier between your mouth and while you're around other people. The best basic way that we know is using masks. And the droplets need to get inside your body, not just after they're spewed into the air, they have to get into either your nose, your mouth, or your eyes. That's why some people use shields to protect the eyes, the face shields, but you really need to have a mask as well, because it's mostly what you're breathing in, the air that you're breathing in is how you get the infection into your body. So when it first came out too, we were not sure. There was more concern around things that were touched, and that people have become, it seems to be not a main way that it's transmitted. So that's the main thing. It gets in the air and you need a mask to protect yourself and to protect other people. It has that twofold. It also is a function of how long you're in the room with someone, because that can tell you how much exposure that you're getting too. So now that we have those basics, now let's think about the services that are provided.
We're committed to doing our best to keep you and the members safe. So before we even think about doing a service request, we try to make sure that it's something that's really necessary, that there are no alternatives, that other ways that the request might be, the person's need might be met, and also to assess how urgent the need is. There's some times when it's not possible to perform a service safely. If a member for whatever reason is not able or willing to wear a mask, we're not going to have you go provide a service for them. If a family member or somebody within that person's bubble is available to help them with a service, we will ask them first. And if there is a need that is really important, getting to an appointment that is something that they really need to get to, we feel we will do our best to try to help our member get there. It is critically important that you listen to yourself. And if for whatever reason you do not feel that you are safe in the situation of providing a service to a member, we want you to call the office and not perform the service. If you, for any reason you feel unsafe, report that to the office, the Meadow at Home office, and we respect that decision. And it's critically important to us that you use your own judgment about your being in a situation that protects you and the member. Laura?
Yeah. So as part of a package in drawing up a policy and procedure, and as part of our commitment to making sure that members and volunteers really know what they're getting into, we've developed waivers. And waivers are it's a type of, I think of it as an informed consent, which is something I'm used to, and that's more in the medical field. But an informed consent is that you lay out the risks, and you lay out how to minimize the risks, and that's really what the waivers consist of. I'm going to go to the next slide, Betsy, because that really talks about the waivers. There's two kinds. One is the transportation and one for in-home services. But the basic purpose of the waivers is that you understand the risks and that you comply with the MedHow at home policy and procedure and protocols, which are written out now. And I hope that you have received them or had a chance to look at them, because that's where I hope that we get some good questions in case we missed anything or if anything's not clear. And also that you don't hold MedHow at home liable if you would develop a COVID infection after the service is provided. So it protects the organization, but also protects you, so that when you're making a decision, if you are willing to perform a service or not, you're making it with good information. And it also includes in those waivers some of the basic things that you need to do. So we're going to talk about that next.
Oops. Now I can get you to get.
You can't change it now?
Oh, I think what I did was put the, anyway.
Cursor in the wrong place.
Anyway, we'll try this. Oh my, here.
Yeah, there you go.
Now I'm going to go back to trying to put you in the picture. Okay, now these are what we are asking people to do as you prepare for once you agree to do a service, and as you prepare for that to provide that service. We're going to ask you to screen yourself and the people you live with for signs and symptoms of COVID. And we're going to ask the member to do the same thing. I can't remember the list, so you really need that policy in hand so you can run down the list of potential symptoms. And that is in your packet, so that you can, and we'll go through the list in a minute. You want to ask if anybody in your household has been exposed to someone with COVID in the past 14 days. This is a conservative standard. It probably is overly conservative, but we would much rather be overly conservative than not. Initially, I was thinking we didn't all need to check our temperature, but we consulted with the Department of Health at the Okanagan County Department of Health, and they felt pretty strongly that this was an important screen. So it means you have to have a thermometer and be able to check your temperature. When you speak to the person who you're going to work with, you want to make sure that they have disinfectant wipes, and if they don't, that you have some that you can bring. And lastly, we want you to have an N95 mask. There are different kinds of masks. The goal of a mask, as Laura went over, is to protect you and others from the droplets in the air that you might inhale or come in contact with that could have virus in them. N95 masks are fitted masks that have that screen out 95% of, is that right? 95% of droplets of all sizes. So they are a more effective way to both protect others, but also protect you from exposure to a droplet. When you wear a cloth mask, you're primarily protecting others from transmission of your droplets, but they're less effective at protecting you from airborne droplets that you might inhale. So the N95 is a mask that can protect both you and the person you're exposed to from inhaling droplets.
Betsy, shall we just mention real quickly that we will have N95s, well, KN95s available for everybody to be picked up either at the North Glover Healing Center porch in Twisp. There's going to be a file on the porch with masks in them, or also a small wooden box at Riverside Printing, Virginia's Riverside Printing, in that little alley next to her box where she puts print orders when they're ready. So
thanks, Tracy. These have been provided by Emergency Management, and they've given them to us to use because they recognize how important these services are that you all are providing. Oops. This is the list of potential of the symptoms that you want to screen yourself for, and that the member will screen themselves for. I think they're sort of self-explanatory. Fevers and chills.
And they're also included in the protocol. Yeah.
Yeah, it's written out in the protocol.
And they were taken from the CDC, right? So
Correct.
they're like right from the experts.
Right. And if there are any symptoms, you're off the hook. we don't want you to go for a visit, or we don't want the member to be visited. So the visit gets canceled.
So Betsy, to clarify, so members are doing this at the same time that volunteers are, correct? So both people are screening themselves, both people are taking temperatures. And if anyone has any elevated temperature or symptom, they're calling MetHow at home and canceling it. Okay.
Correct.
So during the in-home visit, so if you think about what we just talked about, how it's transmitted, we want to think it through about how you're going to protect yourself and the member. So you're going to make sure you wash your hands. Washing hands is best, but hand sanitizer is also a good, if you don't have a place to wash your hands, then hand sanitizer is second best. And everyone should probably have hand sanitizer at this point, and it's available now in the stores at least. And then you should have wear a mask that's covering both your nose and your mouth. Not no below the nose type of mask. That doesn't help because it really is good to cover your eyes, your nose, and your mouth. So making sure that that mask is well fitting. And we're asking them to have N95 for in-home. Is that true? Yes. So, and then you have to make sure you aren't touching surfaces that have not been disinfected and touching your eyes, your nose, or your mouth. And so you're wiping surfaces down before and after you leave. And you are wearing a mask the whole time. And you aren't touching your eyes, nose, and mouth. That's basically it. And then think about so then you're in home and you're at the place. The first choice is to not be in the same room, because as I talked about being in the same room, they're seeing, I don't know how arbitrary the 15 minutes is, but they're saying 15 minutes is sort of the tipping point of being around that other person longer than that. So you really, if you can stay in a different room is better, but not all services are like that. Then you should stay at least 6 feet apart. And I think where most of us are used to that by now. It's going to be weird when we actually can be next to each other again. And then the third choice is if you have to touch one another, wash your hands right afterwards. And of course, if you're outdoors, if you're providing an outdoor service, then you don't, and the member is not present, then you don't need to have a mask. But you should bring your own tools and your gloves so you aren't touching their things. I think pretty straightforward on that. And let me know if any of that is not clear. And then providing transportation. This is a tricky one, but we've had discussions about this, and this is the way that we thought could provide the best protection. I think it's tricky now because it involves having car windows down and it's really cold outside. And so that's the tricky part. But I think, to me, the N95 is really important when you're providing transportation. And I think we might need, if you think about, we already have the vaccine here in the Valley, which I'm excited about, that it seems like it's come sooner, and that a lot of our members are going to be on that list, up at the top of the list, to get the vaccine. And I think we're going to be providing more transportation, or I want to be available in case that need arises. So you're going to have to think about where that person's going to be. How do you get them as far away from you as possible? That would be the back seat and the opposite side of the driver. And you're going to want to wipe down those areas that they can touch. So that would be the door and the handles before they get in, and then you can wipe it down afterwards. You keep the windows open if at all possible, because we need to circulate the air. And I think they're doing that at school a lot too, because they have to think of the same thing. And then that little switch in your car where it recirculates the air, meaning it's the same air just going round and round, you don't want that one on. You want to bring in the fresh air from outside. So both the volunteer and the member wearing N95 masks. And that can be a challenge when you're going to Wenatchee, but that's how it is right now. Until we'll have to rethink this when people start getting vaccinated, we'll rethink it all. But boy, I think we're going to need to do this for a while, because there's a lot, as we said, we don't know a lot of the answers. Can people, once they get vaccinated, it seems really effective for them, but is there some way that they could transmit it to someone else, even if they don't have it by touching or something? I think there's still much we're figuring out.
I think Laura's, our goal is that we take people to appointments that are really important. And Laura and I were talking before this about the importance of getting people to places where they can be vaccinated, and how do they do that? And that is a need that we really hope for, and we hope you all will help us meet. So that's a really exciting thing for us all to be thinking about for the future, for the not too distant future.
Yeah.
And then we're going to have Deirdre talk about after the service.
Yeah, I just want to thank you both, Betsy and Laura, for putting this on and putting the slideshow together. I can tell you put a lot of time into it, so thank you. Yeah, so in normal times, people get back to me with a little report, the mileage, the time spent, and a little note often about how the service went. And that is the same with this. We really hope and encourage you to get back to me, with the time spent, and that is driving included, then your mileage, and we always appreciate a note. So all of that documentation goes into Club Express, our website. We've been doing that from the get-go, and every single note that anybody sends me gets put in there. So it's really important during this time, because we'd really like to keep track of every visit and who's done what, where, and where they've gone. So please, be sure you can either email me, you can call me, you can do it yourself on our website. Some people have found that a bit challenging, but it can be done. But probably just easiest to email me, and then I just copy and paste that and stick it right on the Club Express. We've talked about creating another spreadsheet too, but I think that we can capture all this on our website. So we'll see how that goes.
I think the only thing different, Deirdre, with this is the addition of whether the protocol was met. So if there was any issue with masks, or it was too cold and you had to keep the windows rolled up, or anything different, or how well it went and it wasn't, I mean, it'd be good to get some feedback on the protocol.
Yeah, and all of those notes can go into Club Express. That can all
Yeah.
be captured. But yeah, let us know if there's any issues, if you anything at all. I mean, we just always love a little story, how much you enjoyed being with the person or whatever, or you didn't. I don't know. No, I think been very positive. So we appreciate it.
So we're going to stop this now and thank you, and then ask you for questions about anything. And just remember to unmute yourself if you're going to. Well, it looks like we may have one question. Are the COVID policies and procedures on the website?
Oh, somehow I didn't see the chat. So
So that is
yes.
Marianne.
yes, I just
That was
I
me,
just-
and I'm so new that I don't know these things.
yes. I just asked Mel to put that on to the homepage, and so, but I haven't checked to see if it is there.
Okay.
And we talked about sending it out to all the registrants, but maybe that fell to the wayside. So
Did you not get one, Marianne? Because everybody should have received an email with the policy and procedures. Did you not get it?
I don't think I did.
Yeah.
Everything I got came through Michelle.
Okay.
So
Yeah. And you are not a volunteer yet because you haven't
I-
gone through the whole process.
I know
So,
that.
yeah. That's
yeah,
probably,
so we can get that to you, Marianne. I'll jot that onto my list of things.
Okay.
I don't think we want you to necessarily have to keep your own file for this. So we want you to be able to know where to find it on the website anyway. So that if you can always get a new copy and we'll always send it to you, and that's not a problem, but we want it to be easy for you to find because will need it. You will need it every time you see someone.
be nice for people just to print it if they can and just have it, with you right before you take a request.
Mhm.
So we have a question from Kathy about how to meet the protocols when providing meals and what happens if protocols aren't met. I'll take on we're asking people to follow the guidance. I think this is also CDC guidance about meal delivery, that the meal is preferably left outside the house. Person's notified that it's there and then they pick it up, and that they can then you can then pick up anything that you need from that home later. If they leave it outside their home for 24 hours, you can pick up your plate or your pot or whatever you got. And Deirdre, that's written out somewhere, isn't it?
We need to do that.
Okay.
Why couldn't they wear a mask and take it in?
Well,
No, we're not
No.
sending anybody in anybody's houses yet.
Okay.
I guess, Betsy, my question was more for providing and cooking meals, from outside the pod person to another pod. Are we still good with that?
if you're like a meal train, that kind of,
A meal train, yeah, specifically a meal train.
we are providing meals to people currently, and they're being left out. The instructions are to leave the meal outside the house.
Right, but it's okay to
cook for
bring
someone.
items from your home outside into
Yes.
another home
Yes.
via the protocols.
Here again, the problem with restaurants is not that, not the food as the vector of spread. The problem with restaurants is that when people eat, they talk and they're close
Mhm.
together and they spread droplets. So just like if you were picking a meal up from a restaurant providing takeout food, you can deliver a meal to someone without it being considered a significant vector of disease.
Okay, got you. Thank you.
And your question about what happens if protocols aren't met, I think we'd just be really sad. We're not gonna scold you. I think what we want is for you to feel, if you go to somebody's home and the member is not wearing a mask and refuses to wear a mask, we would ask you to leave, respectfully leave. We don't want to put you in that situation. And that can be hard and awkward, and but it's not your fault, it's ours. We'll take full responsibility. And we really just don't want to put you in that situation. I also have been in a situation where I've been at a home with a person with some with some mild dementia, and they have had a really difficult time maintaining social distance, constantly needing a reminder. And that is probably not a good place for you to be as a volunteer for Meadow at Home. I mean, if you were to make the decision that this person is, well, you may make your own decision about that kind of situation, but I think when we feel responsible for you, we don't want you to be putting yourself at risk in that way.
Okay, thank you.
Is that clear?
We would certainly want to know if you did come to somebody's house and they refused to wear a mask. That would be something we would like to know.
Okay.
Anybody else have concerns or questions?
Maybe.
Marie?
This is maybe a little broader than just the services, but I wonder if you've had people asking you to pick up packages at the post office for them. Has this been a problem? I found that at the post office there are too many people. The post office is not well aired, and sometimes you have to wait because they're looking for packages. It's a little bit overwhelming at this time. And I don't even know if you're allowed to do such things.
I don't think you are.
Haven't had. Okay.
Well, I know that Kathy Bussey, you are picking up mail for Lois McLean, correct? But you're doing it when you pick up your mail. Is that right?
Well, that's correct. And I just, if there's, I just go to the post office boxes. And I don't know, Marie, if you mean the Winthrop post office or the Twist post office, but it's kind of easy in the Winthrop to navigate your way around the package picker-uppers.
Al, do you have a comment about this?
Let's
Or a
see.
different question?
Yeah, Al, you are still on mute, so you might have to scroll
There you
around
go.
on your screen. There you go.
We have a question. Can you tell us again how to get those masks?
Yes. Yeah, so there are two different, there are going to be two different drop-off points. One is at Riverside Printing. Do you know where that is? It's in that little alleyway by the funny t-shirt shop, by where the pawn shop used to be there in Winthrop. There will be a little box, and that won't be there until next week. And then the other spot is going to be North Glover Healing Center. That's on the dead end of Glover Street.
Oh, down the pole.
And we have a porch and there's a file, and it will be inside the file.
I wonder if we could go back to Marie's question I think if we have somebody who's picking up mail, and it doesn't feel like it's a safe situation, then we probably would have you stop. I don't know if there is any way that the post office, I don't know if we should be giving them feedback about their.
I don't know.
And anyway,
Betsy, they've been really good about it, because I've spoken to them about it.
okay.
But mostly I just choose a time when there's less people likely to be there, and that makes it super easy.
Okay,
Right.
great.
You really have
Thank
to choose your time. Mhm.
Yeah.
Yeah.
Twisp is a different situation than Winthrop for sure. It's just a lot smaller and yeah.
What do we say?
You want to say something else? Say it.
Or Coco?
No, it's okay. We were getting our mail picked up because we don't have a car right now. But we just gave Nicholas our key. So it was easy.
That's.
But
yeah.
our daughter just arrived, so we do have transportation now.
Okay, good.
Anybody else? Well, that's, yes.
Great.
Yeah. Should I get a COVID test before I start? I've never had a COVID test, so does that play any part in any of this process and protocol?
We have not included getting tested in our protocol and have relied on symptoms as I think the more part of that is access to testing and the turnaround time on testing and the need for, if you were to test, how does that play out in terms of the actual request? So we have not included that as part of our protocol, and the Department of Health did not recommend that we include that as part of our protocol. They felt that symptom screening and using the mask and using the other strategies that are laid out in the protocol are what's most important.
Would you be interested in finding out how we're getting our daughters to come?
Sure.
They were both quarantined for about 10 days. And Joy just got her a test on her way to Winthrop from Seattle. And she'll get the results in another couple of days. But in the meantime, she's staying at a motel. She's not staying with us until she gets her test results for 4 days. So there'll be 14 days of quarantine before she comes through our door.
Oh,
She will wear a mask though. She insists on wearing a mask.
Oh, good.
that is dedication. That's so sweet.
We haven't seen them for, especially our older daughter. We haven't seen her for a year. We didn't even see her last Christmas. So she's ready to come see us.
Oh, good.
Anyway.
That sounds wonderful.
Merry
Our
Christmas.
daughter does go with a doctor and he just got his COVID vaccine in Seattle.
Oh,
Yeah. So,
Well, Laura, do you want to talk about vaccines at all? What you learned?
well, I don't know that nothing is written in stone, but it just sounds really positive. I did talk to Lori Jones today because I thought people might have some questions about vaccines. And she's really optimistic about us. We've already, about us getting enough vaccines for everyone to have a vaccine that wants a vaccine, really in the next, into January. It was just seemed like she felt like we were going to be getting a bunch. And that sounded really good news to me, because that's how we're going to get to our community protection, is when people get vaccinated, and that will protect our members and everyone else the best. But right now it's a little tricky. We might have to help members access it. I'm not sure. I don't know if everyone's been reading about it, but their temperature requirements have been really strict. And right now, anyone that wants a vaccine, like the healthcare providers, they're having to go up to North Valley Hospital. They have to go to Tonasket to get it.
That's because they have the refrigeration.
Correct, yes.
The
So,
logistics
but the
of-
Moderna vaccine ought to be better, as far as more stable and not requiring that minus 70 degrees. So I'm hoping that it can be dispensed in the Valley at our clinics. But I mean, those are more hopes than anything. But everyone I'm talking to, the healthcare providers, are feeling really excited about it. I mean, I was thinking it was going to be June, but so that's sort of good news to me, because our members are some of the most vulnerable, and how we can help them access that if that's their choice. That's really good. So
Deirdre, you have
yay.
the last comment?
Well, I was just wondering, I've had a few people ask me, if you've had COVID, do you need to get vaccinated?
Probably is what my understanding is. Especially if you've had, how some people have had really mild symptoms, they're still recommending it for them. But of course, our answer would be check with your doctor.
Yeah.
There you go.
Yeah. But that's
Well, we
true.
really appreciate your time. And if there are no other comments or questions or stories, we can let you free to enjoy this gorgeous day.
Yes, thank you, everyone.
Thank you so much.
Yeah, thanks so much for being here, everybody.
Thank you.
Thank you, guys.
Thank you, guys.
Thank
Betsy,
you all.
Appreciate it.
Bye. Take care.
Bye-bye.
Bye.
you got the record. Shall I push record off?